So a lot of you will ask, right? Because the first time I went through natural delivery and second time was C-section. A lot of people, I think, would do their research before they deliver a baby, whether to choose C-section or natural birth. So both involved epidural. And given that I didn't have a very good experience with epidural the second time round, I highly likely wouldn't opt for epidural if I do have a third kid. During my first delivery, which was a natural delivery, the vagina is really pain. I mean, according to the gynae, he kind of like cut 3 centimeters, which was not like a huge wound, but I felt in immense pain. And I must say, I was like sinking, right? I didn't dare to do any physical exercise in that few months after that. I didn't dare to shit or urine or sit on the toilet bowl for long. However, the recovery was faster. In about 1 month's time, I was back to the gym doing like body pump and all, and my body felt fine. I even ski like 2.5 months after. Okay, and you know, skiing is an intense sport that requires core strength. However, second time around, because I had an emergency C-section, which is cesarean, I would say recovery is a lot slower than I expect. I'm in my 3rd month now, and I feel that my core strength is severely affected. I'm still trying hard to build my core strength back. So, of course, the vagina is not pain, and I don't experience urinary incontinence unlike vagina birth. But what I do experience is that the pain in the wound, right, was really painful to even get out of bed, to roll myself out of bed the first few days after the surgery. And the recovery is slower generally. I feel like even now when I touch the wound right now, some parts of it is numb. And the first month, I was really afraid to move much because I was so scared that the stitches would open up, whether it was like external wound or internal wound. I didn't know whether infection would also happen. I was just worried sick. However, shitting and urinating was okay. You know, I wasn't as scared. All in all, I would say that, of course, cesarean, good thing is that it's faster, right? And you can have it planned, timed. It's a lot more predictability. But for cesarean, there's also longer recovery time in terms of the wound and the scar. My scar is still there. There's keloids forming around it as well. Not very ideal, but that's the fact. So I always say, like, a woman's body has undergone like a lot of changes during pregnancy, a lot of sacrifices. So if you're a mother, give credit to yourself. You deserve it. Fellow mothers out there. When I had vaginal natural delivery, right, my milk production was a lot faster. I think my body recognized that I've already delivered a baby compared to when I had a C-section. The breast milk supply came in, I think, 3 days later. So if you are intending to breastfeed your baby, do take note that if you have a C-section, the supply will come in later, most likely based on first-hand experience. What I did to make my recovery faster, to expedite my recovery, was I actually forced myself to walk as soon as I can, because you are supposed to do that so as to activate your muscles. And also I did, like, after 3 weeks, I did the diaphragmatic breathing to help myself to activate my core, and to also do like the scar massage so as to prevent the different layers, the 7 layers that the gynae has to actually cut through to reach the baby, right? To prevent them from sticking together in a layman terms. I don't exactly know the medical terms, and to massage it in circular motions and up and down motions and left and right motions so as to help with the recovery. So I hope that if you're also a mother that's thinking whether to go through a C-section or a delivery naturally, you can watch this video and it will help you with deciding, okay? So any questions, feel free to ask me. That's all. Bye.